In a world that screams for your attention, there's a place that invites you to peace. You don't need a building. You don't need a choir. You just need to turn your heart to Air One.
Air One, songs that heal, lyrics that pray for you when you don't have the words.
From Lauren Daigle to Elevation Worship and more.
This isn't just radio. It's worship for the everyday.
Escape the noise and worship now.
Download the Air One app. Ask your smart speaker to play Air One or visit air1.com. Air One, worship now.
Well, hi, everyone, and welcome to Alzheimer Speaks Radio. I'm your host, Lori LeBay, and I'm so excited that you're joining us today. We are going to have a fascinating conversation, as usual, as we learn from people all around the world at all ages and stages of life. Stay tuned as we shift our dementia care from crisis to comfort.
Here we go. What you think about, you will bring about dementia change. We will.
Well, hi, everyone, and welcome to Alzheimer Speaks. I'm your host, Lori LeBay, and I'm thrilled you can join us today. We are going to be talking about some of the latest treatments and things you can do to protect yourself, prevent, and or slow down Alzheimer's disease. So I think this is going to be a really interesting conversation that we have with Dr. Kaplan. But before I introduce you to our guest, I always encourage people to swing by alzheimerspeaks.com, where you can find all of our free educational resources. You can listen to the radio shows, dementia chats, which are people living with dementia and their insights, their guidance of what's working, what's not, what's needed, which is just absolutely fascinating. Also, dementia in the arts. You can find out information about memory cafes and dementia-friendly communities. You can visit our poetry and article section as well, which is really helpful for so many people. And there's other things there. Those are just kind of the highlights. And then, of course, we have our sister company, which is called Dementia Map, which is a global resource directory. And if you have a service, product, and tool and you're not in there, we want you to join. We have both free and for fee plans, but to the public or any professionals who want to search, it's absolutely free. We'll never ask you for any of your information. So check out alzheimerspeaks.com and dementiamap.com. And I also want to sneak in and kind of give a pat on the back to my webmaster, which is Q for Good. They're absolutely fabulous. I know managing a website can be a lot of work and a lot of stress, and things are always updating. Check out Q for Good. They communicate well. They're reasonably priced. They meet their deadlines, and they talk word friendly because, I'm not a tech person, so they need to kind of dumb it down for me. And with the housekeeping out of the way, let's go ahead and introduce you to Dr. Kaplan. Well, Dr. Kaplan, I'm so excited to have you on the show. We were able to talk briefly online a little while ago, and I feel so aligned with what you're doing, and I think your work is so critically important. So I'm going to ask, if you don't mind, to introduce yourself to our audience.
So I'm Dr. Gary Kaplan. I'm medical director of the Kaplan Center for Integrative Medicine in McLean, Virginia. We've been in practice for about 40 years. Our focus has been on neuroimmune disorders, autoimmune encephalopathy, infectious etiology. So we see a lot of people with chronic fatigue syndrome and people with PANS, and people post-COVID, as well as people suffering with Alzheimer's and some other neurodegenerative diseases. We're integrative medicine practice, so we not only treat with conventional medical approaches, but we treat with looking at a more, it's been overused too much, a whole person perspective, and looking at environmental factors that come into play, which it turns out have a great deal to do with Alzheimer's and all of these diseases, because it's about what's happened to the immune system. Alzheimer's, from my perspective, is a neuroinflammatory disorder, and I believe the profession is finally moving around to that as the focus, away from the amyloid hypothesis. I know there's a lot of controversy with that, but I think amyloid is a downstream issue, not an upstream issue, and more interested in the upstream issues. So I'm also someone who's unfortunately been impacted by Alzheimer's. My mother died from Alzheimer's, and unfortunately my wife in the last few years has been diagnosed with Alzheimer's disease. So I have real personal stakes in figuring out better ways to treat this disease and what we can do in order to manage it and hopefully eventually find a cure.
Wonderful. Well, thank you. And I really appreciate you talking openly about amyloid plaque and that whole big push that we've seen for years and years and years with very little results and complicated results as well, not real definitive. To me, that would always drive me nuts every time I'd see something like that. I'm like, it's bigger than this. It's way bigger than this. There's more things affecting this disease process. And I'm just a lay person, but even from there, you can just see that there's a much bigger picture at hand. And
my wife received the anti-amyloid therapy, since it's the only one approved at this point in time, and developed the lovely ARIAs, so amyloid-related imaging changes that we see on the MRI, both in terms of swelling and in terms of bleeds, because when you take amyloid away, they're coating the blood vessels. And as you start to remove that amyloid, you can get leakage of fluids out of the blood vessels, and you can get small bleeding occurring in the brain. Unfortunately, she developed both those complications, and that was the end of being able to utilize those medications for her. Good news is we had a few other tricks in our back pocket.
Wonderful. And we'll be getting to some of those things. Let's start out with talking about the blood test, because that's a big thing right now too. And I feel like there's pros and cons with all of that. But there's this big push about everybody should get these blood tests to see if they have, Alzheimer's kind of coming in their direction. And they might not have symptoms, but it might be genetically within their being. So what are your thoughts with all of that?
So the first thing you want to think about is that at this point in time, the latest studies say that Alzheimer's is probably about 50% genetically determined, but 50% environmentally determined. So that means there are potential interventions that we can do to prevent the onset of the disease if we can diagnose it early enough. And indeed, it looks like the markers for Alzheimer's are present somewhere between 10 to 15 years prior to the onset of early cognitive decline and ultimately Alzheimer's. So we have a lot of reason, I think, for looking. Now, the challenge is, if you're going to look, I have one patient who is p-tau positive in her 50s who does not have any cognitive decline whatsoever. She wanted to get this testing done. And now the question is, what do you do with that? Well, I think the answer is what we're going to be talking about. There's lots we can do to prevent potentially the eventual development of it. But she has no evidence of the other markers at this time of Alzheimer's disease. So I think it's worth testing. I certainly have had my testing done. You want to start with looking at your genetics. There's a series of genes, but specifically the ones everybody knows about is ApoE44 or 34 or 32 or 23. The highest risk category, that is a 10 to 25% increased risk of developing Alzheimer's, is in the ApoE44 category. Now, that doesn't mean you're going to get the disease. It just means that you're at a much higher risk of developing the disease. And then 3, 4, any 4 in your ApoE, one of the things that the 4 programs for is the ability to remove amyloid from the brain. And so that does allow for more of a buildup. So originally the thinking was, look, amyloid is clogging up the system. Amyloid is then causing tau and creating this whole inflammatory. It's the opposite way, I believe. I believe that really what's happening is an inflammatory process going on. Amyloid is a response to that inflammatory process, and so we're much better off going to the base inflammatory process. So I think it's worth testing. even if you haven't, certainly if you have it in your family. It's also a matter of your ability to tolerate the risk, right? I mean, once you get one of these pieces of information, you kind of start feeling like you've got the sword of Damocles hanging over your head. And then what do you do and how do you treat it? Well, again, because there's this great big window of 10 to 15 years where we can intervene early and potentially prevent the occurrence of it, then I would argue that it is worth taking a look and seeing what we can do to stop that from happening. And so, the Cambridge study looked at about 4,600 studies to map the population level policies that could shift the risk factor. And what did we find? We find that staying educated early in life and keep learning as an adult helps keep your brain sharp. Treating any hearing loss, including with hearing aids, can be helpful in preventing progressive decline. Recognizing and treating depression. Now, that's a double-edged sword because depression can also be a result of a neuroinflammatory disease, and so you might want to look a little bit more into that. But certainly, if depression is there, I think we need to have a conversation about what's going on with it and reduce the inflammation in any way we can. Simple things like protecting yourself from head injuries, but manage your blood pressure, stay physically active, manage diabetes if you've got it. All right, we've now looked at the GLP-1s. These are medications which they're peptides that actually reduce blood sugar, but using low dose of the peptides, we're looking at the possibility of preventing or slowing the potential progression onto the development of Alzheimer's. Smoking, obviously don't. Maintaining a healthy weight. Obesity is a form of inflammation in the body, so we want to get rid of that. Alcohol within moderate limits. And then the big one, and probably the single most important factor in longevity, is social connections, especially later in life. You want to have friends, you want to have family. The more social connections you have, the higher the probability that you won't develop Alzheimer's, and the higher the probability that your quality of life is going to be dramatically better, and that you'll live longer. So social connections actually outstrips pretty much everything else. And then exercise is extremely important. The other interesting things is treating vision loss. Okay, we want to make sure we do that because the less sensory input you get, the lazier the brain gets, if you will. And then exposure to air pollution, we know, has a higher risk of developing Alzheimer's. Again, it's a neuroinflammatory process. So there's lots that can be done, and cholesterol. New findings in terms of cholesterol in the latest recommendations is your low-dose lipid proteins probably should be down around 70 if you don't have any coronary artery disease. If you have coronary artery disease, we want to drive that down as low as 50. So statins, which for years were thought potentially to cause Alzheimer's or dementia, actually don't. And now the new data shows that they can be helpful in terms of preventing or slowing the onset of dementia, and certainly in terms of reducing heart disease risk. And one thing I'll make a big plug for is, aside from having a proper, full examination of your lipids, including lipoprotein A, which is a genetic factor, but I have a brother-in-law who just had a heart attack, okay? Well-educated, smart guy, been seeing his doctor. He's had difficult to control blood pressure. He's had not had a lot of attention paid to his lipids, and he never had a coronary CT scan of his coronary arteries. CT scans of your coronary arteries, cheap, about $125, $150 if you have to pay out of pocket, and can look at and see whether or not you already have onset of coronary artery disease. You should know that piece of information. He didn't know that piece of information. He had a 90% blockage of his left anterior descending. He could have died. Unfortunately, did not. But that test was never done for him. And it should be part of routine physicals on people. So there's lots you can do to stay healthy without when reducing your risk in terms of ongoing dementia, but also overall quality of health. And then other things that you can do that get more refined is whether or not you have toxins in your system, mold toxins or heavy metals. About 20% of the water supply of this country is contaminated with lead. And so there are things that can be done in order to reduce that risk and get that out of your system. And whether or not there are other things going on post-COVID, they just upped the number of people who have post-COVID syndrome. We thought it was a couple of million. It's 12 million, according to an article in JAMA 2 weeks ago. So 12 million people suffering of post-COVID syndrome. That screws up your immune system and makes you much more susceptible in terms of developing more rapid onset of dementia if you're headed in that direction. My wife, her first real demonstration of Alzheimer's showed up after getting COVID. So this disease, COVID, is not a mild thing, and the immune system tends to overreact to it. And so the other thing is, though, that she got another case of COVID. She's had 4 cases of COVID now. On her last case of COVID, a mild case, not a big deal, but she wakes up a couple of days later in the morning and she says to me, "Where are you going?" And I said, "To work." And she said, "What do you do?" And I went, "Oh shit." So I walked over and sat down next to her and said, "Sweetie, do you know where we live?" And she said, "No." And checked her out on a couple of other things and then bundled her up and took her into the office. We treated her with some IVs and peptides that we use. We treated her with intranasal exosomes. These are not approved procedures, okay, but stuff we've been using in the office for years. And indeed, in 3 days' time, she was completely back to baseline. So, there are things we can do for acute degeneration in this condition, and then there are things we can do for longer-term slowing of the progression of the disease.
Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Zinnia offers research-backed videos intentionally created for people with dementia, engaging, calming, and easy to follow. Whether you need to ease agitation, create moments of joy, or make daily routines smoother, Zinnia is here to help. Family and professional caregivers use our content to turn challenges into opportunities for connection. Accessible by subscription on mobile devices and connected TVs, Zinnia is simple to use whenever you need it. Because when caregiving feels easier, life feels better. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
So I just want to clarify for people, have you clarify, not approved, does that mean you can still use it, but it's not covered by insurance?
That is correct.
Okay.
That is correct. They're not FDA approved. There's not been big trials on them, but there's nothing that prevents me from doing them in medicine. So
I just wanted to make sure that people didn't think you were doing some voodoo stuff,
People think I'm doing voodoo stuff anyway, but the reality of the matter is we're doing everything we do is within proper medical bounds.
Okay. Wonderful. Well, I love that extensive list. I mean, that's really powerful, and it really gives people a perspective on getting these tests. My big thing with the tests is how are they going to be used from our insurance companies, both health insurance and driving in the future. And, I guess as I've gotten older and society has changed, I'm less trustworthy of how things are going to be used once the data is there. But, now that we know, and it's finally kind of accepted that, this can start 10 to 15 years ahead of time, and you've got that time to work with to make these changes, I think is really important. And I really, really, really appreciate that you talked about the importance of staying socially connected. I think so often that is missed. And, for my mom who lived with the disease for 30 years, I think that's why she lived 30 years. She felt connected totally until probably the last 3 years. But It was harder to tell if she felt connected at that point just because she had declined. But the routines were the same, the voices were the same, those types of things. I think all matter. Also, like that you talked about toxins and the pollution, because I don't think people understand that as much as they need to really appreciate, how things have changed over the years and what it is. I mean, I just had windows cleaned and I'm like, our windows didn't used to get this dirty before, it's just like, it's different than when, I'm 67 when I was little. And maybe you can say, well, you weren't paying attention to that. I'm like, oh yeah, I still had to clean windows when I was little, but they just seem like they get gunkier faster after every rain. You can see the difference. Well, I want to dig into the knowing that the symptoms can appear decades before, really subtly. And I think we've always thought that a lot of this is just kind of normal aging, or maybe it's just totally hidden. I have a hard time personally, and again, I'm not a doctor, of are they hidden or are they there? Because I think when people still have cognitive abilities, they're really good at hiding that stuff and not letting other people know. What are your thoughts on that?
So I think we want to make a distinction before of the symptoms showing up, whereas the biology is showing up way earlier than the symptoms. The brain has a huge amount of capacity. There's one company that I work with called BrainScope. What they do is they measure EEGs. It's a little device that you put on your head. It is going through the process of getting FDA approval at this point in time. But I had an article come out in Nature magazine within the last year demonstrating that they could predict with high certainty the risk of Alzheimer's disease easily 3 to 4, possibly 7 years before the onset of the disease in individuals with the BrainScope. So here's a device that you can do in the office, okay? Get a readout and be able to predict this. This is a device that's already FDA approved for diagnosing concussions. But the BrainScope is a device that's coming and will hopefully have FDA approval for diagnosis of Alzheimer's and able to predict the onset of the disease years before it actually shows up clinically. So what we want to do is catch this disease as early as possible. And the earlier we can catch it, the higher the probability is that we'll be able to either delay its onset, and I think eventually we'll be able to prevent its onset. We really want to get to it earlier. Once it's already present, then you got a bigger problem because now you've lost a lot of brain capacity and there's a lot of damage that's been done. We want to get to this damage early on, stop it, and do everything we can. And indeed, the REQUIP study, the study that Bresden's work is doing, has shown that doing things like brain games, especially things that we're rapidly having to adjust to situation, strategy games like playing chess and Go, these things can help slow the progression of the disease. I want to throw in one other thing that's not specifically Alzheimer's, but JAMA study, I believe it was JAMA, a year or two ago, showing that people who live on golf courses had better than 2 times the risk than the rest of the population of developing Parkinson's disease. So let's pay attention to the fact that we're getting exposed to these pesticides and herbicides, and in the case of, and as you moved away from the golf course geographically, as you get further away, the risk started to match the rest of the population. So it's lovely to retire onto a golf course, but may not be so good for your brain. And this is probably it's not proven, but certainly it gets suspicious that these chemicals are leaching into the water and certainly being breathed as they're being applied to the grass on the course. So there's a lot of things we're doing in terms of pollution. Air pollution, yes, but also pollution from herbicides and pesticides becomes a big factor in what's going on. So we want to make sure we're not poisoning ourselves on a regular basis.
Wow, that's really interesting. Yet it makes a ton of sense. Makes a ton of sense. I know we've had here in Minnesota some big lawsuits with toxins and things and the spread, and showing that, here it was more cancer that they were focused on and stuff. But, nobody wants that either.
Well, undiagnosed celiac disease, okay? Celiac disease is an autoimmune disease. That's about 1% of the population, but glucose intolerance, not glucose, but gluten intolerance. Gluten intolerance is somewhere between 16 to 18% of the population. Now, an interesting thing happens. Now, you're still getting inflammation as a result of this. It's still poisoning you. So we really have to take gluten out of your diet. But my patients who go to Europe are able to eat the baguettes and their croissants without any problem, even though they can't tolerate them here. Why? In Europe, they don't allow for GMOs, genetically modified organisms. So the reason for modifying the grains is so that they're resistant to the herbicides and the pesticides. So you can dump them all over the place, higher yield crop, but the plants take up these herbicides and pesticides, and it moves from the field to your Cheerios, and then you consume them. So it's really glyphosates, I believe, is the basis of the problem. We use glyphosates in wheat as a drying agent. And so we dump a lot of chemicals on our food, and it ends up in us, and it turns out it's probably not good for us. And so we want to pay attention to that so that we're not poisoning ourselves on an ongoing basis.
Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Zinnia offers research-backed videos intentionally created for people with dementia, engaging, calming, and easy to follow. Whether you need to ease agitation, create moments of joy, or make daily routines smoother, Zinnia is here to help. Family and professional caregivers use our content to turn challenges into opportunities for connection. Accessible by subscription on mobile devices and connected TVs, Zinnia is simple to use whenever you need it. Because when caregiving feels easier, life feels better. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
Yeah, it is interesting to watch. I remember just having a loaf of bread and in my little kitchenette in the office, and I had it there for a month and it didn't mold, and it was like, okay, this is really not good. This should be bloody moldy ages ago. Yep. And but stuff like that we don't always, I think, process. And it makes a huge difference. What are some of the limitations with the amyloid plaque drugs? You had talked about, the brain bleeds and things like that. Just even going in for the infusions and stuff, I would think it would be really time consuming. And
honestly, that's not horribly time consuming. But the reality of the matter is, first off, these drugs will slow the progression of the disease on a good day. They'll slow the progression somewhere between 18 to 37%. Now, what that translates out to is 5 to maybe 9 months. Okay, it's slowing the progression of the disease. It ain't a cure. And then if you develop the side effects of the drug, as my wife did, very serious problems. So these drugs are not curing. These drugs are slowing progression. Better than nothing. Now, if you compare that to the Grifold studies that were done using therapeutic plasma exchange, therapeutic plasma exchange does not have any of the ARIA side effects, has very low side effects. And what we're doing is we're cleaning the blood. We literally hook you up to a device like a dialysis machine. We put the blood through a separator. We take out the plasma. We give you new plasma back. The side effects of doing the treatments are next to none, maybe a little bit of pain at the injection sites and bleed. Takes about 2.5 hours in the office. The plasmapheresis, doing about 6 of those and then repeating them several times a year, slows the disease 50 to 65%.
Wow.
Without the side effects. we did that for my wife and virtually reversed all of the problems we were having with Aria. So, here we have unfortunately not covered by insurance. It tends to be a bit expensive. They're about $5,500 a treatment. But, from my standpoint, what's my wife worth? And so we've given her about 8 of the plasmapheresis at this point, and it dramatically improved her condition where with the anti-amyloid drug, she's been going downhill. This is not an FDA-approved process yet, but there are good studies backing it showing that it is effective. Another drug called TB006 is now available for compassionate use. That's an anti-galactin drug. So that's addressing more what's going on with the tau issues. And tau drugs are where the next generation of drugs are going to be focused. And so that's available for compassionate use and given once a month. Again, because it's compassionate use, not FDA approved, it's not getting covered by insurance. Again, it's about $5,000 a treatment. It's given once a month, but we're utilizing that therapy as well here in the center. So I think the treatment of this disease at this point needs to be individualized and comprehensive, meaning that there is a time and a place when you can use the anti-amyloid drugs. Although some additional studies are questioning whether or not they actually have the effects that are being published at this point. But still, I'd keep them in the arsenal. But I would also, I want to look at your whole health. I want to look at your cholesterol levels. I want to look at your overall, how healthy are you? How's your digestive system? Are you eating foods that are good for you? How's your stress level? How's your sleep? Okay? Sleep apnea affects 5% of the population. That's where you stop breathing at night. Okay? And oxygen levels go down. Well, that's a bad thing because your brain is now getting what's called hypoxic. And so that'll make you stupid. That'll make you sleepy. And that'll cause depression. And so it also causes obesity and diabetes, and it'll take 10 years off your life. Getting tested for it is very easy. As a screen, there's a thing called an Epworth scale. Everybody can do an Epworth. Very, very easy. Just go online, EPWRTH, and take the Epworth scale. It's a series of questions that you can answer on a scale of never to always. And if you're scoring 10 or more above that, you need to talk to your doctor and see about sleep apnea. If you're having short sleep, meaning you're only getting about 5 hours a night, that's another problem unto itself, even without the apnea. Of people who have apnea, 85% are not diagnosed. Okay, those people are at horrific health work. Now, quick funny story, I have sleep apnea. All right, I was coming home from vacation, and I always carry an apnea machine with me, always. I carry it on the plane with me. So if I'm going overseas, I use it on the plane if I'm sleeping. But I checked it coming back this time because I didn't feel like carrying it because I've got 3 apnea machines at home. So I was confident that if they lost a machine, I still had plenty more. Well, we went to pick up our bags, and there were 2 women there who were guarding the bags because we got there after the bags had been pulled. And I said, that's my bag, that's my bag, that's my bag. And she checked the thing. I said, and also that CPAP unit. And she looked at me and she said, you checked your CPAP unit? You need to keep this with you all the time. You have no business checking. Do you have any idea how many of these things we have back here that people have forgotten and lost? You need to keep this with you. This could save your life. You have no business to. I thought it was absolutely hysterical. It was so sweet of her that she was that concerned. But it does. These devices save lives. And so you need to know if you've got sleep apnea and get that treated. So there's lots of things we can do about your lifestyle, your diet, your cholesterol, that we can intervene with to get you in optimal health. And we can also reverse some of the problems you're having. There's a test, a fairly elaborate test we do called NeuroAge that actually does a whole bunch of genetic markers and other metabolic tests that can actually tell you how old your brain is relative to your biologic age. Okay, I've done the test. I come out about 10 years younger than my biologic age. But it gives us some dials we can turn, ways to intervene that can help us get you set on a much better course. So there's lots that can be done in lifestyle changes and diet changes, in medication changes. There are some medications that may accelerate the development of the disease, anticholinergic medications and some over-the-counter antihistamines. So you want to be paying attention to that. So we want to look at your medications and find out if there's anything that's actually potentially making you worse, and can we substitute them out and change them. So there's lots we can do. But again, what you want to do is you want to take a comprehensive, individualized approach, and that's going to get you your best outcome in terms of preventing the onset of the disease as well as slowing the progression of the disease if you have it.
Okay. I'd like to talk a little bit about some of the new therapies. You've been talking about inflammation and metabolism and digestive systems and things like that. Can we dig a little bit deeper into those and how that can affect things?
Well, let's go infections. Okay. Lyme disease, in rare cases, actually looks like dementia. Mm-hmm. And so we live in a Lyme endemic area. And so you want to be testing to make sure you don't have Lyme disease. You want to be testing that you're not post-COVID. There are things we can do to treat these conditions. And so we want to look carefully and make sure that there's not an infectious process that's actually going on immediately. There are, as far as your diet is concerned, we want to make sure that if you're allergic to 14 foods, your problem is you have a leaky gut. Okay, now a leaky gut means is that the intestinal wall has become permeable, and now large molecules of foods are getting into the bloodstream. The body doesn't like that. It makes antibodies against that. So now we have to find out why you have a leaky gut. Do you have small intestine bacterial overgrowth? Do you have problems with multiple food allergies? Do you have drugs that you're taking that are creating problems in the gut? And so looking at that and fixing that, and it can be fixed, getting you on proper diet. Do you have gluten intolerance? So we want to look very carefully at your diet, what you're able to eat, what you're not able to eat. And using probiotics in order to be able to help repair the gut. Again, we want to look at probiotics that are more specific for you, and we're getting better at understanding what that is. So there's lots of things that we can do in terms of helping your digestion, getting your nutrition straightened out. More plant-forward diet is looking better and better all the time. An overall healthy diet is a Mediterranean diet, has the best evidence for it, but increasingly looking at a plant-forward diet is also extremely important in terms of protecting your health and reducing inflammation in your system. So sleep, diet, exercise, extremely important. Looking for toxins that are potentially in your system, also extremely important. Mold toxicity. Mold toxicity affects a large number of people, probably somewhere about 20% of the population. And what does that mean? Mold is ubiquitous in our environment, and especially in water-damaged buildings, mold grows and it produces a toxin to protect itself, except that about 20% of people cannot digest that toxin when we either breathe it in or eat it. It comes in our food, it can come in breathing the air. And it's all indoor molds that we're looking at. And so, especially black mold, sarcophacins. And so we want to be able to test for whether or not you have mold toxicity, and we can. And then we need to treat that. And there are things we can do to get those mold toxins out of your system with a combination of binding agents and a combination of glutathione and acetylcysteine. So there are things we can do to treat them, but we have to go look. And so everything starts with a comprehensive history. My intakes are 2 hours. So I sit down, I want to know when was the last time you really were in good health? And I'll tell you, the first thing people do is they lie to me. I was last in really good health until I got COVID. Super. And then I'll take the rest of their history. Well, so I got COVID 3 years ago when I was 37. Okay, well, I've had migraine headaches since I was 12. Oh, really? Okay. And menstrual periods that are brutally painful and very heavy. Okay, that's a problem. And I've had problems with depression that I've been struggling with since my teen years. Well, now we're getting a very different picture of what's going on. So I don't want to know just when this symptom started. I want to know what your whole life has been looking like. And there's a thing called adverse events of childhood. Okay? If you've had abuse in childhood, and you can go online and look at a whole list of things, it's about 12 of them, and they include things like neglect as well as sexual and physical abuse, problems with high stress in the family where perhaps one member of the family has been incarcerated or divorced. So there's a lot of things that fall in that category. And it turns out if you have 3 or more, you have a dramatically increased risk of developing depression, obesity, diabetes, autoimmune diseases later in life. So being able to identify those issues and get them properly treated can make a difference in the quality of your life. And it turns out they're neuroinflammatory in the central nervous system. So we want to be able to address all of those things. So we're looking at sleep, we're looking at diet, we're looking at your cholesterol and heart issues, metabolic issues. We're looking at your blood pressure. We're looking at your weight. We're looking at diabetes. We're making sure you're not smoking. We're making sure that alcohol is at least moderate, preferably none, as things go on these days. We want to make sure if you've got hearing problems, we're addressing those. If you've got vision problems that haven't been addressed, we're going to tell you a quick funny story on that. I am driving with my son to go look at colleges at night, and Matt and I are chatting, and he says to me, "Dad, what kind of car is that in front of him?" And I said to him, "It's an Escalade. Can't you read that? I mean, Escalade, on the back of an Escalade is these 3-inch letters that say Escalade." He said, "No." So I had a second pair of glasses in my car, and I handed them to him, and he puts them on, and he goes, "Wow." And I'm like, "Oy."
This is going to make school much easier.
Oh my God. So yeah, things happen gradually and we don't quite notice that we're losing our hearing or we're losing our vision.
Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Zinnia offers research-backed videos intentionally created for people with dementia, engaging, calming, and easy to follow. Whether you need to ease agitation, create moments of joy, or make daily routines smoother, Zinnia is here to help. Family and professional caregivers use our content to turn challenges into opportunities for connection. Accessible by subscription on mobile devices and connected TVs, Zinnia is simple to use whenever you need it. Because when caregiving feels easier, life feels better. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
I want to make sure that we're seeing the ophthalmologist on a regular basis and that we're getting our hearing checked and making sure all of those things are being addressed. So there's lots we can do in order to help you get healthy and stay healthy and hopefully prevent the expression of this disease, even though you're at risk.
Yeah, I just wish the insurance companies would cover more of this stuff than what they do. But, again, we're kind of I don't know. I know we're supposed to be preventing things, but it doesn't seem like that's really our healthcare model in reality.
It is not, and it's a shame, and it's criminal, and it actually costs us more money in the long run.
Mm-hmm. Yeah. Well, and just, the emotions behind it all and the stress and the finances. And I mean, it gets overwhelming. And we're not taught in school, like the prevention, families have, anyways, in my family, we never talked about prevention because prevention, back then wasn't even a thing. No one, nowadays we hear people talk about preventative matters and stuff. And I just find it super interesting. I had never heard of this adverse child events. but it makes so much sense. It makes so much sense, and how that affects our body as a whole. I don't know if there was any more that you wanted to talk about with the GLP-1 drugs.
So we've got another one coming. It's a GLP-3 that'll be coming out. It looks like it's even going to be better than the GLP-1s in terms of helping prevent the progression of this disease. It may. So this early studies, look, GLP-1s are lovely in terms of weight loss, but they help in prevention of heart disease. They help in prevention of kidney disease. They're metabolically rewiring us in order to be in a much more healthy state. I am not the least bit overweight. I take low dose GLP-1s every week. So they're drugs which can prevent. I think they're going to be really approved as the first longevity medications available to us. So there are drugs that can prevent that from doing. Two other drugs that I think are particularly interesting are using low-dose naltrexone. Low-dose naltrexone at high dose is used for treatment of drug overdose and also for alcoholism. But low dose, using 1.25 to 3.5 or 4.5 milligrams, reduces inflammation by its action on the microglia, which are the white cells in the central nervous system. So we use that on a regular basis to help reduce neuroinflammation. Another drug that looks very interesting is lithium. The debate is between lithium carbonate and lithium orotate, but low-dose lithium, 150 milligrams, is also anti-inflammatory in the central nervous system. So that's another medication that we can use in terms of treating these things. So we've got tools available to us and things we can do to help you get healthy, stay healthy, and preferably prevent the onset of this disease, or certainly slow the disease if it occurs. Going back to therapeutic plasma exchange, there are studies demonstrating that therapeutic plasma exchange is also useful for longevity. So in healthy individuals, we can use therapeutic plasma exchange to reduce all of the inflammatory factors on you and the biologic clocks set back by about 2.5 years. So if you're 50 years old, we do the therapeutic plasma exchange on you. We can actually reduce your biologic age to 48, 47. Okay, so it's removing inflammatory factors in you. And so everything we can do to reduce inflammation is going to be beneficial for you.
This is kind of off topic. What do you think in terms of, I know we're living longer, than what we used to. Does it scare you that we keep extending this at all? Or do you have any negatives to that? Or do you just see that all as a positive?
So the issue on longevity is quality of life. It's not number of years, it's quality of life. So keeping people alive and warehousing them for the last 20 years of your life is of no interest to me whatsoever. But keeping them alive so that they can continue to be productive and act. Listen, retirement age used to be pretty much 65, period. Okay? I'm 72. I am not planning to retire anytime in the near future. I am healthy and I love the work I do and privileged to be able to continue to do it. So how long am I going to work? I don't know. I'm going to work until I can't or until I feel that I've done what I can do productively. But certainly I'm looking at a 5-year window at a minimum. I like what I do. I have fun doing what I do. And so I plan to keep going for a while. So longevity is about quality of life, vitality, being able to do more of what you want to do longer. Okay, and hopefully also compressed mortality. So what happens is at the end, as opposed to this long progressive decline, what happens is you die fairly suddenly. I want to say one other thing because it's just been in the news. So Lindsey Graham just died of an aortic aneurysm. Okay, we can, hardly tragic thing, but we can actually do testing to look for that on a routine basis. We can do a whole body MRI. About $2,000. Insurance isn't going to cover that, but it will identify those kind of things. It will identify an aneurysm that you otherwise might not pick up in a standard physical. And so we're able to do more comprehensive evaluations and get to things earlier. The whole key on longevity is finding things earlier. So, or as a friend of mine says, the key to longevity is not dying of anything stupid. So But for Graham, had he done a whole body MRI,
Mm-hmm.
probably have identified that aneurysm and been able to treat it without him dying.
Wow. Yeah, that's a really, really good point. Gosh, you've given us such wonderful information, and I appreciate your definition with longevity, because I think sometimes people forget about the quality of life piece, and to me, that's core. If I don't have quality of life, I'm fine to exit. At whatever age it might be, and I know not everyone agrees with that, and I'm not expecting them to, but I just think that is so critically important to take into the equation.
Spend time with your children, your grandchildren, your spouse, your great-grandchildren. All right? Being able to have a full, active life, being able to continue to contribute. Those are all extremely important. Having meaning in life is extremely important.
Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Zinnia offers research-backed videos intentionally created for people with dementia, engaging, calming, and easy to follow. Whether you need to ease agitation, create moments of joy, or make daily routines smoother, Zinnia is here to help. Family and professional caregivers use our content to turn challenges into opportunities for connection. Accessible by subscription on mobile devices and connected TVs, Zinnia is simple to use whenever you need it. Because when caregiving feels easier, life feels better. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
Now, in wrapping up, I know you've given us a ton of ideas here. Are there any things that you want to just highlight again of what people can do to protect their brain and lower their risk of dementia right now that they can jump into?
Pay attention to your social circles.
Mm-hmm.
Exercise on a regular basis, at least 4 times a week, doing good aerobic exercise, but also strength building, because the muscles secrete different things when you're strength building and help reduce inflammation in the body. So exercise, get your cholesterol checked, get your blood pressure under control, manage all of those things. There are so many things you can do right now without having to get fancy. And those things should be done. So those are the top things that I would go after what you can do. I would also, if you're worried, get checked. Again, you're absolutely correct about what you said in terms of testing for p-tau 217 or doing the PET scans, because it does increase your risk of your life insurance company potentially throwing you out. But it also, the reality of the matter is they usually take blood work on you beforehand, and they probably have this information on you already. And anybody who's done 23andMe, this information's already sitting there. So I understand the hesitancy in doing so, but if you're willing to take action and you're willing to get involved, there's a lot that can be done to keep you at high quality of life. So I would encourage you to buckle up and get going. Certainly, I would take the Epworth test on the scale and make sure your sleep is doing well.
What do you think about, like the chair exercises? You had mentioned aerobic and things like that. But there's stuff all over the internet now about Tai Chi and things that are a little bit slower but get people moving. What are your thoughts with that?
Brilliant. There's good data on them. Tai Chi and Qigong, extremely beneficial and does reduce inflammation in the brain. I would, without question, it reduces stress, improves sleep. I would unquestionably do those things. One of the ways we measure your longevity is how many times can you get up from sitting down in a 1-minute period, okay, without using your hands. So the faster you can do that, the higher the probability, the longer you live. Can you stand on 1 foot for 30 seconds? Again, these things are correlated with your longevity. And so doing strength testing, doing yoga, doing Pilates where you get your core strengthened. Those things are all going to be extremely beneficial to you.
Okay, wonderful. Well, Dr. Kaplan, thank you so much for spending this time with us. I know how busy your schedule is. Now, people can contact you at the Kaplan Clinic, which is kaplanclinic.com. You are on Instagram as Kaplan_clinic. You are on Facebook as the Kaplan Center for Integrative Medicine, and on TikTok as the Kaplan Clinic. And we'll have all of that in the show notes as well. And I'm assuming through the website, they can shoot you an email and so forth on that.
And we have a lot of information on the website and webinars we've done. And so there's lots of information that's freely available by going to our website. At Kaplan Center for Integrative Medicine, kaplanclinic.com. And there's a lot of information on the website. So I would encourage you to do that and look at any of the webinars we've done and other podcasts we've done.
Fantastic. And you're also listed as one of our awesome partners on Alzheimer Speak. So if you scroll down to the bottom of any page, they will pop up there and you can click on them. And we're looking forward for you being a member on Dementia Map as well. So again, thank you so much to our audience. I always ask you to be a giver of hope. Like, click, and share. You don't know who in your sphere, if it's Facebook or Twitter or TikTok or Instagram or LinkedIn or whatever it might be, who needs this information. There are so many people worried about the facets that we've talked about today, but they don't talk about them to other people. So we don't always know. And the more information we can get out there in a friendly fashion, the easier it's going to be for people to reach out and get the information they need. So again, Dr. Kaplan, thank you. And to our audience, thank you again. Please feel free to go to alzheimerspeaks.com to our free educational resources, and then also search our global resource directory, Dementia Map. Until next time.
Lori, I just want to say thank you for having me on the show, but I also want to say thank you to you for having the show. This is extremely important work you're doing, so thank you.
Oh, thank you. That's nice to hear. I've been doing it a long time, and I enjoy hearing all of the things that are available to people. You know, we need to be able to connect people to these resources, products, and tools, and raise the voices of all the wonderful people like yourself doing amazing work that can really help people in terms of their quality of life. So thank you.
Thank you, Lori.
Bye-bye.
It's time to rethink, renew, and reimagine retirement. Hey everybody, Jared Sebesta here, host of Retire Repurposed. Now this podcast is about the non-financial parts of retirement, which many times can be even more challenging than the financial. We believe retirement is not the end, rather the beginning of what could be the most impactful, purposeful, and fulfilling season of a person's life. So don't retire, become repurposed. To listen now, search Retire Repurposed on your favorite podcast platform, Senior Resource, or Life Audio.